Epistaxis, or nosebleed, is divided into anterior and posterior types. Approximately 90% of all nosebleeds originate in the anterior nasal septum, specifically from an area known as Kiesselbach plexus. To understand epistaxis, we have to recall the vascular anatomy of the nasal cavity. The nasal septum and lateral nasal wall receive a rich blood supply from both the internal and external carotid arteries. These arteries form anastomotic networks that become key sites of bleeding. The most common site of epistaxis is the anterior part of the nasal septum, specifically the region known as Kiesselbach plexus. Kiesselbach plexus is formed by convergence of several arteries. From external carotid artery goes facial artery, and the terminal branch of facial artery, which is superior labial artery, is the first blood vessel involved in formation of Kiesselbach plexus. Also, from external carotid artery goes maxillary artery. One of the branches of maxillary artery is greater palatine artery, and greater palatine artery is the second blood vessel involved in formation of Kiesselbach plexus. Another vessel which goes from maxillary artery is sphenopalatine artery, and the terminal branches of sphenopalatine artery are the third component of Kiesselbach plexus. The second major artery that provides blood supply to Kiesselbach plexus is internal carotid artery. From internal carotid artery goes ophthalmic artery, and the branches of ophthalmic artery, which are anterior ethmoidal artery and posterior ethmoidal artery, are the last two blood vessels which form Kiesselbach plexus. In contrast to this, we have posterior segment, and posterior segment is formed by proximal regions of sphenopalatine artery, and important that damage to this region can cause life-threatening hemorrhages. So this is a posterior segment, which is formed by proximal regions of sphenopalatine artery. We have to know that Kiesselbach plexus is located just beneath the mucosa. This superficial location makes Kiesselbach plexus highly susceptible to trauma, dryness, and irritation. But at the same time, because of its location, epistaxis originating from Kiesselbach plexus is typically easily visualized and usually mild. These bleeds are usually self-limited. In contrast to this, epistaxis from posterior sphenopalatine region tends to be more severe, often profuse, and difficult to localize. But why in first case epistaxis is mild, and in the second case severe? To explain this, let's depict blood vessels of Kiesselbach plexus and blood vessels of sphenopalatine region. Because Kiesselbach plexus is formed by terminal branches, blood vessels in the plexus are more narrow compared to sphenopalatine region. From physics, recall that blood flow is equal to pressure difference divided on resistance, and resistance is inversely proportional to the radius. Obviously, with damage to the blood vessel, the blood loss will be proportional to the blood flow. And if in case of the narrow blood vessels of Kiesselbach plexus blood loss is mild, in case of sphenopalatine region, because the vessels are large, resistance will be lower, and with decrease in resistance, blood flow increase, and higher blood flow in case of vessel injury will cause a more severe blood loss. So it's the reason why we consider posterior epistaxis more dangerous. The most common scenario of epistaxis on test is epistaxis due to the foreign body or trauma. Also, pathologies like allergic rhinitis and nasal angiofibromas can greatly increase the risk of epistaxis.